AI and XR-powered digital therapeutics for autism and ADHD, revolutionizing diagnosis and treatment in a world where developmental disorders like Autism Spectrum Disorder, ASD, and attention deficit, hyperactivity disorder, ADHD, touch the lives of millions. Both families and healthcare professionals have long wrestled with the challenges of diagnosis and treatment. The complexity of these conditions means that traditional approaches are often slow, resource-intensive, and can lack the precision needed to fully support those affected. But as technology advances, so too does the way we approach care. Enter the age of digital therapeutics, DTX, where artificial intelligence, AI, and extended reality, XR, combine to create groundbreaking solutions, bringing new hope for personalized, effective interventions. Challenges in traditional diagnosis and treatment. The road to diagnosing and treating ASD and ADHD has historically been a frustrating one for many families. For ASD, the diagnostic process can take months, even years, as clinicians piece together extensive behavioral observations, interviews, and questionnaires. Each case is unique. No two individuals with autism present the same set of behaviors. Some children may struggle with speech, others with social interactions, and yet others may display repetitive behaviors or experience sensory sensitivities. The variability makes it difficult for healthcare providers to detect the condition early and accurately. To further complicate matters, girls often present symptoms differently than boys, leading to delayed or even missed diagnoses. ADHD presents its own set of challenges. The symptoms, such as difficulty concentrating, impulsivity, and hyperactivity, can overlap with other conditions like anxiety or learning disabilities. This makes diagnosis difficult, often relying on subjective reports from teachers or parents, which may not capture the full range of the child's experiences. These traditional methods often result in delayed treatment, robbing children of early intervention opportunities that could dramatically improve their quality of life. How digital therapeutics overcomes these challenges. DTX offer a way to break through the limitations of traditional approaches. Through advanced AI systems and XR technology, DTX enables continuous, personalized monitoring and intervention that helps healthcare professionals make more precise and timely diagnoses. AI-powered diagnostics, a game-changer. AI is revolutionizing the diagnostic process. It brings precision, speed, and real-time insights to a process that has long relied on piecemeal observations. Imagine a child named Liam, who has been struggling with focus and impulsivity. In a traditional setting, Liam's diagnosis might involve long waits for appointments, followed by extensive consultations with specialists. However, with AI-driven systems, Liam could wear a device that monitors his focus, movement, and even emotional responses throughout his day, at home, in school, and during playtime. The AI system would continuously analyze the data, detecting patterns and fluctuations that provide deeper insights into Liam's attention span and behavior. Unlike traditional methods, which rely on limited observations in a clinical setting, AI evaluates a child's behavior in real-world conditions over time. If the system detects significant attention dips during class time, it can flag this for Liam's healthcare provider, allowing for early and targeted intervention. AI doesn't just collect information, it actively learns and adapts to the individual's profile, creating a more nuanced, accurate diagnosis. For children with ASD, AI offers even more transformative possibilities. Subtle behaviors, like the way a child makes eye contact, responds to social cues, or reacts to sensory stimuli, are often difficult to detect during brief clinical evaluations. But AI-powered systems can monitor these micro-behaviors in real time. By using sensors and cameras, AI tracks social and emotional interactions that might go unnoticed by even the most trained clinician. This data is fed into machine learning algorithms that compare it against large datasets of other children, helping to pinpoint signs of autism earlier and more accurately. Personalized and adaptive care with DTX. The true power of DTX lies in its ability to deliver care that is not only personalized but adaptive. Traditional treatment plans often take a one-size-fits-all approach, offering a set number of therapy sessions or generalized interventions that may not fully address the individual's needs. DTX changes this paradigm by continuously adjusting treatment based on real-time feedback. Take Emma, for example, a 7-year-old diagnosed with ADHD. Before DTX, Emma's treatment consisted of periodic therapy sessions and medication, with her parents and teachers struggling to manage her fluctuating attention levels throughout the day. With DTX, Emma's attention and behavior are monitored in real time during school hours using wearable devices. If Emma's focus starts to wane, her teachers receive an alert suggesting strategies to help her refocus, such as offering a short break. Meanwhile, her parents receive daily reports, allowing them to adjust her home routine based on what triggers or supports her attention. For children with ASD, DTX provides virtual environments where they can practice social and communication skills. These immersive, AI-powered simulations allow children to engage in real-world scenarios, like greeting a friend at the playground or asking for help in a store. In these controlled settings, children can practice without the fear of rejection or embarrassment, while AI provides instant feedback, adjusting the difficulty based on their progress. XR-powered therapy, immersive, personalized treatment. XR technologies, such as virtual reality, VR, and augmented reality, AR, are transforming therapy by offering immersive environments where children with ASD or ADHD can build essential life skills. Consider a 9-year-old named Max, who has difficulty focusing in class due to ADHD. Traditional therapy might involve sitting in a clinical setting, practicing focus exercises. But with XR, Max steps into a virtual classroom, where he practices concentrating on a task while the system gradually introduces distractions, like birds chirping or classmates chatting. The virtual world is a safe space, allowing Max to build his focus step by step. And the system adapts in real time to his performance. If he's doing well, the challenges increase. If he's struggling, the system eases the difficulty. For children with autism, XR offers similar opportunities. Social interactions can be challenging, but in a virtual world, children can rehearse these situations. A child named Maya might practice initiating a conversation with a virtual peer or learn to interpret nonverbal cues like body language or facial expressions. With AI guiding the interactions, the avatars respond to Maya's progress, offering more complex scenarios as she improves. These immersive experiences give children a chance to learn and grow without the social pressures of the real world. Current status: where we are today, DTX is already making waves in the treatment of developmental disorders. DTX products are showing promise in treating ADHD through gamified interventions, where children engage in immersive gameplay designed to improve cognitive functions such as attention, focus, and emotional regulation. These products leverage AI to adjust the difficulty of tasks based on the child's performance, ensuring a therapeutic experience that is both challenging and rewarding. Similarly, XR platforms are being used in autism therapy to teach social and communication skills in gamified environments. For example, children can engage in role-playing exercises with virtual characters in a simulated grocery store, learning how to navigate social interactions. These systems provide immediate feedback, and the therapy adapts in real time to ensure that each child is challenged but not overwhelmed. Future directions: expanding the horizon as AI and XR technologies evolve, the future of DTX for ASD and ADHD care looks even brighter. In the coming years, AI systems will become even more adept at diagnosing developmental disorders before they fully manifest. Predictive algorithms will analyze data from infancy, enabling early interventions that could dramatically alter a child's developmental trajectory. We may also see AI-generated avatars that not only guide children through therapy but respond with empathy and emotional intelligence. These avatars could detect a child's emotional state and adjust their responses, providing more personalized and supportive interactions. Imagine an AI avatar in a virtual classroom recognizing when a child with ADHD is becoming frustrated and offering calming strategies or positive reinforcement, much like a human teacher might. XR therapies will continue to evolve, offering even more lifelike and responsive environments. Virtual worlds could be designed to mirror specific real-world challenges, from socializing at school to navigating public spaces. As XR technology becomes more affordable, these therapies will be accessible to a broader range of families, including those in underserved or rural areas. A new era for autism and ADHD care. AI and XR-powered DTX are not just enhancing the way we diagnose and treat ASD and ADHD, they are completely revolutionizing it. By moving beyond the limitations of traditional methods, these technologies offer real-time, personalized insights and therapies that empower children to manage their symptoms, improve their cognitive and social skills, and ultimately thrive in their everyday lives. As these technologies continue to evolve, they will usher in a future where diagnoses are made earlier, treatments are tailored to the individual, and therapy becomes an engaging, positive experience. This is the future of developmental disorders care. A world where technology and empathy come together to create lasting change for patients with ASD and ADHD, giving them the tools they need to succeed.